Hello, hello.
Yeah, I think we are here on live, right? Okay, so good evening to those who made the effort to join us and to be with us this in the next 1 hour. So I'm here with Dr. Chris Prue. Hi, doctor.
Hello, hello.
So today we will discuss about performance rehab module overview and ankle instability. Chris, am I right?
You are correct. You are right. Absolutely.
Great. Okay, so then of course I will follow on the chat if you have few questions and so on. Of course, don't hesitate to share with us. Chris will be able to answer, I hope, to all your questions.
I will. If I don't know the answer, I will make it up. Um, no, we will. We will find the answer.
Okay, Chris, the stage is yours.
All right. Thank you, Oscar, and thank you all for attending. I see there's a lot of people registered that have done this several times, and I'm surprised you're not tired of me yet, but that's okay. So anyway, um, so if you're new, this is a recurring webinar. So we do this every month, and it's product specific. So we're covering the Digital Pro product and how to evaluate the analysis, right? So the system provides you this data output, and we need to be able to read it and decide, what can we do with that information. So we choose a different case every month to go through the process and to highlight it. So even if we go over, one of these modules again, we try and make it different. So there's some different examples and some different data of how to go through the interpretation process. And after the last one, someone told me, wow, you do such a good job at spending so much time on something that doesn't normally take that long. And I'm given the gift of, as we call it, gab, which is, my ability to talk excessively. But in seriousness, the idea is, normally I can go through an analysis and do my report of findings, which is your consultation with the client or the patient in really just a few minutes. But, this is an exercise in, attempting to cover a lot more material. So I'm going to share my screen and we're going to get going. So the first thing I'm going to look at is we will define what these tests are. And let me pull up a little presentation here. So the performance rehab module is utilizing 4 specific tests or test typologies or procedures, however you might want to refer to it. So there are four different jumps or hops, and I know in some countries it's the same term, used for all of these. But so there's a single leg hop, and then there's the single leg side hop, and then we have a single leg triple hop, and then we have a double leg counter movement vertical jump. So even though they're single legs, we actually perform it on both legs, so that way we can make the comparison. This is my son; he's 9, so he's new to this, but he's a great model. And the purpose of these tests is they were originally field tests. Now, the counter movement vertical jump has a long history of both being a field test and performing it on technology or equipment to provide us a great deal of information. So the basis of these tests were part of the rehabilitation process, what we call return to sport or return to play. So they're actually commonly used tests, and they're not the only tests. Obviously, there are more out there. We specifically chose these due to the support in the literature as well as its high utilization. And so what we did was we took these commonly used tests, but we provided a lot more information or data to them, because historically a field test is designed to be easy, not using a lot of equipment, and unfortunately it also doesn't give us a lot of data. So these tests for the single legs, the single leg, single hop, the triple hop, and the side hop, typically are evaluated really just based on the distance covered in the single hop and the triple hop, and then the number of jumps in the side hop, and that was pretty much it. So we know that there's a lot of support in the data that's provided to us. And let me pull up and show you my screen here. So we know that there's a lot of support in the outcomes, right? Which is the number of hops or the distance. So what we've been able to do is then provide a lot of that more detailed data that, if you needed some more equipment to be able to accomplish that. And obviously we have that. If you're here, then you probably already have the Digital Pro or you're looking to get it. So most of you know that there's an online application. So on the computer, I go to this a lot because it gives me a lot more flexibility and robustness, a lot more detail in the data. And I can do some things like I can generate a PDF file report and easily download that, put it in my patient files, or send it to the patient or another practitioner or their coach, for example. And so there's a little bit more robustness here. And this is where I can have all of my patients and all of the data. So the online application, just like your mobile application, can house the walk, the run, as well as the performance rehab module, which is this sort of jumping module. You can also view your videos on this as well, because there is a video option to the DS Pro. This is also where I can download it. And some of you have seen me present in the past where I download the video and I can run it through another different type of analysis software if that's something that you wanted to do. The other thing that is really good with regards to the online is I can look at the evolution, and I've shown this in the past. What that is that is a graph of all of the metrics, and let me show you that real quick. So I can use that to see how things have been changing over the course of treatment. This is just a file that I use for different types of patients. So, but I'm going to click on. So here's the walk evolution. So this shows you each dot is an evaluation, right? Is a data collection and an analysis. And so we can see that there's multiple walking analyses done, and it can show you the evolution over time. Like I said, this is multiple patients, so this isn't really a true evaluation of all the different ones, but this allows me to provide an overview of all of these different metrics. And you can, as you can see, you can put your cursor over each one of those to capture that specific metrics data points for that particular evaluation. All right, so let's go to the practitioner analysis, which shows me all of the reports. So we're going to do the counter movement jump to start with. I like to start with that one first. So if we think about the procedures, some people may just want to do a counter movement vertical jump. I tend to do usually my top three. My top three are going to be a counter movement, and then I do the single leg forward hop, and then I do the single leg triple hop. So I start with the counter movement because that one is the least complex. It allows them to use both legs. Always have your patient warm up. I would even have the patient perform this a couple of times. So in research, we've determined that, about 80% of subjects will perform best on their second trial. 15% will perform best on their third trial, and 5% will perform best on their first trial. So if you do this at least twice, then most people are going to do their best on that second one. Another option is just have them warm up, and usually on their second or third attempt, record that one and then use that for your data if you don't want to collect the data more than one time. As we have with all of the analyses, you can input some of this information in your summary. Some of this you can do on the mobile app when you're actually collecting the data. Okay. Information on shoes. So I have a standard, and sometimes I'll put that in the comment section, what type of shoes they were wearing. If you want to be repeatable, especially in performance tests, because remember that the sensor picks up different foot orientations, and that can be impacted by the types of shoes, the type of footwear that you're wearing. And so if you want to get those changes over time and to make sure that you're consistent, that's a variable that you're going to want to control, is to have the person wear the same pair of shoes each time they're being evaluated. If you can't control that completely, especially with children, because their feet grow, obviously, as they're aging. And so, at least be consistent really with the type of shoe, such as a specific running shoe or a specific basketball shoe or something to that effect. So as you saw in the video, the counter movement vertical jump is performed with both feet on the ground. They start in an upright posture position and they go down and up as quickly as possible. And the reason for that is we're looking at the ability to capitalize, to be able to use that, what's called the stretch shortening cycle, right? That's the elastic nature of the musculotendinous junction, where there's an elasticity component to the muscle, which can be assistive in the muscle contraction. So that's a positive benefit from that. So that's why this is called the counter movement vertical jump. So we can see the differences actually between the right and the left foot. So that's why this is still a really good test to do, because there's often going to be some differences. So today's subject is ankle instability. And this is actually a chronic ankle instability. So this is someone that experienced many injuries when they were younger, and then still have some issues in that left side. So their left foot, they tend to have more issues than they do on the other foot. So the first thing that we can look at is the comparison between the flight time. And one would question, well, why would that be different? Well, it depends, because if you're not getting full extension at the hip and the knee and plantar flexion, that foot is going to come off the ground sooner than the other foot, right? So there's going to be some limitation in that, because otherwise you would you would sort of jump to the side if there was too much of a deviation. And of course, the normal reaction to the body, neurologically especially, is to be as symmetrical as possible, which is why we can't really see this with just visual observation, and collecting that data is going to be important. So we see on that left foot, they have a significantly longer flight time, right? And that's exactly what's going on here. And it's a difference of 84 milliseconds. So there's longer flight time on that left foot than there is on the other foot. So that's the first thing to take into consideration. Now, with a lot of these jumps, we don't have normative values like we see with the walking profile. So somewhat similar to what we see in running is it's going to be impacted by their abilities, by their power output, their strength, and things like that. So historically, a lot of this information was really comparing the right to the left when we were making a determination of return to play or return to sport, to know that we got the injured leg or the surgical limb back up to the level of the non-injured or the non-surgical limb. So even in a counter movement, that's why I still do this, even though it's a double leg takeoff and landing, because theoretically the body is trying to basically make it very symmetrical. And so despite that, control by the neurological system, we can still see some impacts. Okay. And you get jump height. So there is normative data in jump height, and that normative data is typically going to be related to a sport. Okay. And it's also related to the level. So, for example, high level school footballers, there's some average, data for how high they can jump, even at some of those lower levels, and then at university, and then at that professional level. So this is a former, high school level athlete, but so it really wouldn't matter for me to compare that. But if you do have an athletic population, some of that data is actually going to be out there. So in the standard view, it just shows me 3 of these across, which is the flexion angle at takeoff, the takeoff velocity, and the contact stability. And so we're going to go over all of this, but these are going to be similar metrics for all of these jumps. And that's what, makes this less complicated, is that once you understand the metrics for one, you also need to understand the mechanics behind each one of these jumps. So for example, when someone does a counter movement vertical jump, so when it's vertical, they are going to take off from their toes. So they're going to take off from their toes and they're going to land on their toes, which is different in a horizontal jump where they're going to take off from their toes and oftentimes they're going to land from their heel, right? Or very similar to if they were actually running. Okay. Now, when I do jumping assessments, and in fact, even when I do running assessments, I like to take a walking assessment too, because the walking assessment does have some normative data to it. And I like to see how they perform even at a lower level of function, because that may give us some indication to their higher level of performance when they're running or when they're jumping. So the flexion angle at takeoff, which is over here on the left, that's the angle between the base of their footwear and the ground. Okay. The ground should be horizontal. So you want to do this on a flat surface. Okay. It could be outside, it can be on a court, it can be on a track, it can even be on the field. But know that when someone is jumping in a field versus a court, those numbers are going to be a little bit different. So again, controlling your environment, controlling for the test retest reliability will be important. So this is the angle here, and it's going to be an indication as to the degree of plantar flexion. Okay, so we actually see that there is good plantar flexion, and let me stop for a moment here too. So in the research for chronic ankle instability, um, most of the research shows that the data is not very conclusive with regards to being able to establish or predict some of the impact with chronic instability of the bad ankle compared to the other ankle. And part of the reason is because sometimes people actually perform for the outcome, which is the height or the distance, pretty normal, but it's some of those other characteristics. And we'll get into this a little bit more. But so what we're going to be looking at, a really large part of our focus is going to be symmetry, but I will provide some other interesting, hopefully, information to you as well. So we see that there is some abnormal symmetry here, and with an ankle instability, it's either going to be high or low. And so we don't have any complete characteristics to that. So it really is going to depend on whether or not, they've had some good rehabilitation or they have some really good strength to generate, enough force. And so what we see here is 36 degrees is actually pretty good. And in fact, I would like to see the right side better than what it is. But again, here's part of the problem with this double leg system takeoff is the neurological system really wants to correct for that. So it's going to try to perform an outcome measure, the distance or the amount of power that each leg is going to generate, and try and equate that, to some extent. So that's why it's going to be good to actually do some of this individual or single leg information. So both of these are actually within a good position. So for a vertical jump, you typically want to see at least 25 degrees in the flexion angle at takeoff. Okay. And they should be pretty close if their limbs are actually pretty close in generating their speed. One of the reasons that we may see something like this is the takeoff velocity was actually higher on the left. And one would say, okay, well, why is that possible? It wouldn't make a whole lot of sense. Well, here's why. If we actually had them on a force platform, what we tend to see, even in this double leg takeoff, when there's this degree of asymmetry, and the body is naturally saying, okay, that limb with the instability is not going to be as strong or as powerful, or the mind is also thinking it's either painful or it could be painful if I don't do it right. So there's probably an asymmetry. In other words, the person actually shifts to that more supportive side. And that's what makes it difficult if you don't understand the mechanics of jumping, which could be a bit of a challenge, is they shifted to that side and they're favoring that side to produce most of the lift that you would actually see. Okay. And so without as much resistance, there could be an increase in that takeoff velocity on that injured leg, where otherwise, we would want to see that. What we will typically see in the single leg action is there could be a tendency to be a bit of the opposite. And we'll talk a little bit more about that when we get to the single leg, but that's not always true either. Again, it'll depend on the overall performance is going to give us more information. So the contact stability is, if you're familiar with what's called Romberg's quotient, right? So Romberg's quotient is part of Romberg's test, which is a balance test for sway. And so we do it eyes open and we do it eyes closed, and the person sways back and forth. You have to do this on a balance platform that collects the information. But what it does is it detects the degree of deviation from center, and then it also detects how quickly I automatically get back to that normal center of mass or that average center of mass position. We're not doing that here exactly, but that's a calculation to show that, okay, how much do they actually sway, right? Because if they sway too much, they may not be getting really good sensory feedback. Okay, it may be an increase in duration, right? And then we're also looking at, okay, once the body detects when they're off, before they become unstable, how quickly do they get back to that position? So we're actually showing a similar characteristic here. We're showing the delta, which is the difference between when they first landed in on the ground and the degree, the amount of motion that took place within that first 250 milliseconds. Okay. Why 250 milliseconds? Well, when we look at the muscular reaction to stimulation of high forces or high velocities, um, and this is not a reflex, obviously, but this is a stimulation pattern of absorption of energy, right? So we're trying to create stability. And so we're looking at how much someone moves. And you want to see small numbers here. You don't want to see large deviations. And especially in the counter movement vertical jump, because we're landing on both feet, there aren't many problems that I would consider where someone would have really large deviations, and they really shouldn't be that different between side to side. So we like to see a small number, right? Single digits, especially. Um, and please excuse this. I'm in my beta environment. It's the testing software, and so these degrees, the negative orientation doesn't mean anything. So disregard that negative for now, because that's screwing up here. So the amount of motion that took place in the pronation and supination in the first 250 milliseconds was 5 degrees. Okay, on the right it was 3 degrees, and then this number below it right? This is the speed at which the correction took place. So you typically want to see, high numbers because it means that they're moving relatively fast. And so you would like to see typically something greater than 20 degrees per second. And it's not unusual to see lower numbers when there's a very low deviation here, right? Because they didn't have to overcorrect too much, and that's why we tend to see lower numbers. When we see correction of high single digits or double digits, this number has got to be fast. Otherwise, it means that they don't have really good motor control, and they were unable to get into their stable position as quickly as possible prior to potentially having an injury. I showed an example of a jumper, I think it was 2 months ago. And so even though he normally landed well, the problem was that, his deviations were so far off, he wasn't able to correct that. Right. And so that's what we're talking about, is the ability to become stable as quickly as possible. And again, if you think about 250 milliseconds, my ability to stop and be able to change direction. And so in that video that I showed the participants, it showed that in fact his injury didn't take place on the way down. It actually took place on the way up. So that's why it's so important that we stabilize ourselves before we make those changes. So then I click on the advanced, and the advanced now gives me all of the characteristics. Okay. So we looked at flexion angle at takeoff, we looked at takeoff velocity, and now we've got rotation around the Z axis. Rotation around the Z axis is like foot progression angle that we see in walking. So this is the amount of toe out position, right, on landing, the external rotation of the lower limb. Okay. Now, most people actually land fairly neutral, especially in a counter movement vertical jump. The further that we toe out, just like with walking or running, the higher the moment of force at that knee joint, especially in that valgus position. So with rotation around the Z axis, again, we like to see as close as possible. And then specifically, we like to see less than 30 degrees. Less than 30 degrees means that it's fairly neutral and doesn't cause any immediate pain. I will tell you that in the triple hop and in the counter movement vertical jump, where it should be really normal, these horizontals, and even in this counter movement, they really should be within that less than 20-degree angle. Otherwise, it means that they're using a strategy where they're towing out too much. And let's think about that for a second. Because we use vertical jumping and horizontal as a test, sort of the environment of when someone is slowing down, right? Run, 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 run. I need to slow down and change direction or catch a ball or kick a ball, whatever the case may be. But being able to slow down and be prepared to change direction. So let's say on this left foot, if I was decelerating from a run and then I'm about to turn to the right, I'm actually going to get more right external rotation because my foot is in ground contact, but the rotation is going to take place at the hip joint, the iliofemoral joint. So I want to make sure that I don't have excessive external rotation even before I start changing or turning direction, right? Because that's one of the mechanisms for the non-contact ACL, but certainly increasing those abnormal moments of strain throughout the entire lower limb, right? Because typically the toes and the knees, the patella, should be pointing in the same direction, in the same plane. Okay. So again, we want to see some low angles here, typically less than 20 degrees, and we do want them to be as close as possible. So we see a slight external rotation here. If I'm worried about that, I would actually do another test, which we did. We did the single leg test, but it's horizontal, which gives us a little bit more information. So this is, again, why it could be important to take more than one analysis. Max acceleration at landing. So the max acceleration at landing is like strike force. Okay. But we're using an accelerometer. So remember that a lot of our calculations are based on algorithms against gold standards. And so, our reliability and validity is very high, but there are no really good algorithms in the literature for acceleration at landing from different types of hops and jumps. So we represent this in G's, right? Gravitational pull, which is 9.81 meters per second squared. So the amount of G's. Okay. Now, this is going to be affected by how high they jump, their body mass, and their landing strategies. And so one would expect in a counter movement jump where we're taking off and landing on both legs that it actually should be very similar. Okay. They're not. This one is actually more than 2 times the right leg. Well, what does that mean? Again, that high degree of asymmetry is something to take into consideration. And it's telling us that we don't have as good of a landing strategy here on that left side. And that could be because of that ankle instability. And if we think about, like I just mentioned, the takeoff in a vertical jump is toe off and toe down, right? So the most common ankle injury is plantar flexion, right? Inversion ankle sprain. So those people with that chronic instability, that's a that's a position of concern for them, even, unconsciously. It's kind of like taking someone who normally, has had many shoulder dislocations and putting them in this position. They do not like to be in that position because that's the position that's weakest for that particular joint. So we're showing that the landing strategy for this person, even though it's a bilateral jump at the same time, is much higher. And here's why: the flexion angle at landing, right? So remember the flexion angle at takeoff. We said we want to be greater than typically 25 degrees because that means we're probably getting full extension at plantar flexion, full extension at the knee, and full extension at the hip, right? That's performance, right? That's, my ability to produce power. Um, the injury aspect, reducing injury risk, is the landing strategies, right? And what you want to see is you want to see a very similar angle at landing, okay? So look at this flexion angle at landing, and we see 28 degrees on the right. Their takeoff was also 28 degrees. But we see that the landing strategy was only 6 degrees. So that meant that they were actually landing almost in a neutral position, right? Here's the problem with that is we are reducing the lower limb's opportunity to absorb that energy. So remember that your ankle joint it's a class 2 lever, and that's a very structurally advantageous lever system. So it can produce a lot of force or it can absorb a lot of energy depending on its size. And so we're missing that opportunity to absorb some of that initial impact. And that's why we see over here that there's a higher impact, right? Now, what can happen? Well, really high impacts, can be detrimental for anything along that kinetic chain. We're usually most concerned with the knee joint, but certainly hip problems, low back problems. If you have an older adult patient, that could potentially lead to some fracture issues, some stress fractures or an overt fracture if they have osteoporosis. So this means this is also why they had a longer flight time, okay? Because this foot, the right foot, came in contact with the ground much sooner than the left foot. Okay. I hope that makes sense. But so, for example, here's the position for the right foot when it landed. Here's the position for the left foot when it landed. It was almost in a neutral position. And you don't want to land like that. That's not a really good landing strategy. Okay. Pronation and supination at landing. So what I have found and why I like to do my walking analysis, even when I'm working with something like this, is I find it to be pretty similar to the toe off position in the walking analysis. Okay, from that stance phase. And so they're pretty normal. We do see that, it's much higher in the right, which means that they're probably in a greater position of supination than we see on the left. And again, that makes sense because too much supination in that position, they're fearful of potentially having that injury, right? Because that's not a stable position for someone with chronic instability. Okay, and we've already talked about contact instability. So to recap, again, doing most people wouldn't think of, what is the purpose of doing a counter movement vertical jump with both legs bilateral to measure ankle instability, but this actually shows us, a lot of that information that if I'm training someone and I don't understand why they're not capable of improving in their vertical jump, it's the limitation on the abnormal side. So let's move quickly into these other ones. I won't need to spend as much time because, like I said, the characteristics are going to be the same. So I said, then I do a single leg hop. So the single leg hop is a forward hop. It's going to be horizontal for distance. And historically, that metric that we were using to evaluate is going to be the distance that they cover, right, horizontally. And the literature has shown that it should be, 10% or less. We see that this is significantly different. Okay, we're at 71%. So that's a 29% deficit between the right and the left in the distance that was being covered. So that would be interesting and, not something very complicated to be able to assess, but let's look at some of the more specific details that might actually help us understand why that is. Is it because they don't have a good strategy of takeoff and landing? Is it a weakness issue? What is the problem? So again, we get single leg orientation of flight time. We see that, 181 milliseconds versus 213. It makes sense because if you're jumping further, you should be in the air longer. This is also interesting in that this person jumped 5 centimeters higher, right? So when they're jumping outwards, remember that you also need a certain trajectory that you get off the ground. And so they also jumped higher in their trajectory in their horizontal jump, which is another reason why they had a longer flight time. All right. Now, when you're doing a horizontal jump, your flexion angle at takeoff is going to be greater, right? Because when you're vertical jumping, right, think about the axis of rotation and the tangent, right? The tangent of takeoff versus when you're horizontal, you're trying to go more forward, right? So your trajectory of pattern is going to be different. So you should see much larger angles of flexion at takeoff. And it wouldn't be unusual for someone who jumps really far. If you were to test a triple jumper or a broad jumper or a long jumper from track and field, you would see their angle probably approaches something like 90 degrees or even greater, right? Because they're so good at capitalizing on that trajectory moving in that horizontal fashion. But remember that, basically from a physics standpoint, for distance, it's about 45-degree angle, from here should be the center of mass trajectory. So the lower limb, that strategy, we found that at the ankle is going to be about, it can be as high as close to 90 degrees, right? Which again is the foot orientation. So much greater angulation on that right foot. So they're taking much better advantage of pushing off from that lower limb on that side. Okay. As a result, we also see a much higher takeoff velocity. And again, it makes sense. The faster your velocity when you take off, the further you're going to be able to jump. Okay. Pronation, supination angle at landing. Again, we find that this is actually going to be somewhat similar to someone who is in their walking profile or their running profile if they're a normal runner and they have a decent running ability, because remember that they're landing on that single leg, sort of like running. Unlike walking, there's going to be a reduction in that base of support, and that's going to change those angles slightly. Versus in the counter movement vertical jump, it's very similar to the walking. This is actually going to be a little bit more similar to the foot strike position when they actually run. Contact stability, we've already covered this, but as we can see, we've got a higher angle here. So they actually move 10 degrees on that left side and only 2 degrees on that right side. I will say at least they did move fast. And remember that when we see a real small angle deviation, it's okay to see a smaller angle here as long as it's typically greater than 25 degrees per second, right? That's how quickly they got to that stable position. Let's click on advanced here real quick. Rotation around Z-axis. We see that it's being represented by a negative angle. So the negative angle actually means that they toe in slightly, okay? And that's not as good either. We don't want to see any more toeing in than typically negative 10 degrees, because now they're going to be putting a lot of varus stress on that knee. And that means, stress on that lateral collateral ligament. So we want this to be less than 10 degrees. We'd like it to be pretty close to 0 or in the single digits, or lower double digits in the positive orientation, as we see in the foot progression angle. But we do see very similar between the two. Max acceleration at landing. Remember, I told you there are certain characteristics that influence that, which is going to be how far they jump, how high they jump, and it is higher on this side, okay? And it's because they didn't jump as far. Well, if you're not going to jump as far as high, you're not going to have the same strike force. And so that's the reason behind that. As we're training them, if we are training their landing strategies and they do improve, this number should actually go down, and they should start to equalize too, because if we're rehabilitating their bad side, their left side, we should be able to improve their overall performance. Flexion angle at landing. When you do a horizontal jump, you take off from your toes. And if you do a full reach out, if you watch this on an experienced jumper, okay, we don't land on our toes when we do a horizontal jump. We typically land on our heels or on a relatively flat foot. So I'm actually okay with this 9 degrees, but then again, they didn't jump very far anyway. The 19 degrees actually tells me that they really extended that leg, and that means that they were okay going into that position. But these are not dramatically different, so I'm not sure I would say that they're too different. But again, knowing that left foot didn't travel quite as far. Pronation, supination angle at landing. Like I said, it should be very similar to, say, a run. However, we see that it is dramatically different between these two. And again, that could be because of this stability issue down here. And actually, we show here that they actually had to move 10 degrees. So they ended up in a very similar position once they became stable as they did on the right. It's just that they landed with a position that didn't seem to be too stable for that particular foot. And that's why they had to perform a lot more correction than they did on that right side. So we're definitely seeing some signs of issues between the right and the left. Let's look at the single hop, or excuse me, the triple hop. The difference in the triple hop is we do 3 hops in a row, and you're telling the person to jump as far and as fast as they possibly can, right? And the reason for that is we want to look at that sequential nature and their ability to perform, okay, repeatedly over and over again, but then have the appropriate motor control to stick that last landing. So that's important in these hop tests, is they have to stick that last landing, which means that no additional hop at the end, okay? So we do see some similar distances between the two here. There is a 6% difference, and it's favoring that right side, so they are jumping further. Okay, but sometimes it's a little bit different. So this person actually occasionally feels comfortable enough to jump a little bit further, or they didn't jump as well on the other side, but it's consistent, right? So the average is actually about 30 inches. But on this side, we see that it's inconsistent. We've got a 26.8, then we've got a 32, then we've got a 26. That's also very characteristic of instabilities, is they don't have as good a motor control. With the triple hop, you can actually calculate a reactive strength index. And the reason is because we have contact time or stance time. This is also very important. This is why I like to evaluate this, especially if I'm testing a runner and I find something, abnormal on contact time for the runner, is I do this. Is it a strength issue? Is it a power issue? And what we see here is the stance time is 774 milliseconds for each one of those. It's on average 461 milliseconds, right? That's a very, very different profile between the right and the left. That means that on their left side, they're not really capable of generating that force or power repeatedly quickly, right? So from a performance standpoint, that's not very good. That's going to limit their ability to run and jump on both feet, and certainly on this left side. So they don't have good reactive strength to turn that over. So even though there was only a 6% difference, which previously, if that's all we were looking at was the distance, it's not, most people would say, okay, that's normal. It's actually not normal. That's a very significant difference between stance time. So their ability to react to landing and then taking off again very quickly is not very good. So again, let's look at the angulation differences here. So with this, we can actually see each one of the jumps. And again, we've got flexion angle at takeoff. It's favoring the right side for each one of those jumps that was further. And we see, if you remember, jump number 2 was further on that left side. So that flexion angle at takeoff matters. Okay, so it does make a difference. So does velocity, right? And on that right side, it's favoring it each time. They're not that far off, with the exception of really on this third one. Rotation around the z-axis. The reason I like to look at this 3 is there consistency or is there a progression in that? So we find that there's some inconsistencies, especially on that left foot. It's much better on this right foot, and I like that they actually land when they needed to be able to stick that landing fairly neutral on that right foot. Max acceleration at landing, just to be expected. They were similar in terms of the distances that were being covered. So it makes sense that the longer the distance, they actually had a higher landing force, or higher landing acceleration, I should say, which is related to force. But so at least they're somewhat similar between the two. And again, I want to see symmetry. And after training or rehabilitation, we would probably want to see these come down. Those are actually pretty high based on the performance of this person. I've seen much stronger, more powerful people jump much further and have much lower acceleration rates at landing. The flexion angle at landing, consistently, we see that it's reduced on that left side. So that tells me that they're not really going into full leg extension position, and or is a result of how far they're going. Supination at landing, we see that they're much more neutral on that right side than they are on that left side. And that could be why they're spending more time in ground contact, is because this is not their stable position. They have to make some changes in that. And again, we see that fairly consistently across the board here, but there's not a lot of difference between the two. And you really shouldn't, especially because the amount of ground contact time that they have. And we do see some higher changes here. So there's a lot of mobility, a lot of motion going on, and attempting to make more corrections on that left side. All right, let's quickly look at this last one. The 30-second side hop is, how should I put this? It's very vigorous, if not brutal. And so it's 40 centimeters that you have to cover jumping from side to side. And that can be a challenge, especially for shorter people. And so the algorithm in the system, it won't record jumps that don't meet within a standard deviation of that criteria. So that's why we see such a dramatic difference between the numbers of the right and the left, right? They actually did jump more than 11 times on that left. It's just they didn't jump far enough. So technically speaking, we would have to call this test a bust. It wouldn't count. But I kept it because it still gives me all of these other characteristics, right? Things like, flight time and stance time. Flight time was much shorter because they didn't jump as high or as far on that left leg. Um, we see contact times are somewhat similar, but again, they have an advantage of not really jumping quite as far or as high. They didn't work as hard on that left leg, and so that kind of makes sense there. We see that the endurance. So this is the cadence, right? They're pretty consistent on that right leg, but on the left foot, the endurance really started, to teeter off about 3/4 of the way through, right? So this is a 30-second test, and so they definitely don't have the same endurance. And as we saw with stance time in that triple hop, they certainly don't have the same characteristics there. These characteristics for the metrics in the side hop, we still have them. I won't say I don't find them as important, but I do find rotation around z-axis is fairly neutral because they tend to follow the tape. The propulsion velocity is going to be similar, or it's going to be related to, I should say, the flexion angle at takeoff. These are pretty similar. So it's more of a test of, can they go back and forth from side to side really for that number? And I find that a lot of these characteristics tend to be pretty similar between the two. So mostly I look at this test especially for, can they even do it? What is the actual number, right? So we see that up here, very different. And so that's an indication of really a motor control and or a strength and power issue. And then we see that they just simply don't have the same endurance that they have on that other side. Whew. There's a lot to this, especially because I think this is new to a lot of people. So it seems like there's a lot, but remember, once you understand all of the characteristics, it's going to be the same. But you do have to sort of understand that, they're going to be a little bit different in terms of the trajectories. Like I said, in that triple hop, it's a really challenging hop. There's another validated test of only 30 centimeters, which is going to be better for shorter people because that's going to be more relative to the distance that they can cover with their limbs and their center of mass. And so I think we may end up changing that at some point. But like I said, it's still a really good test to see if they can actually, compare between the right and the left.
Chris, we have
Yes,
some
sir.
questions. If you go to the chat,
All right. Recommend the literature digital. Yeah. So if you just, look at return to play, is a search string return to play criteria following ACL or lower extremity injury, then you'll get a whole lot of information, right? So we didn't make up these tests. These are tests from the literature. So you can also individually look up counter movement jump, 30-second side hop, the triple hop, or the single hop jump. So those will be test, or excuse me, those will be search strings that you can use. How these insoles find a person more. So will it actually make a determination between, plantar flexors or hip flexors? So what's different in jumping versus, walking or running, it's going to be very difficult, not to use the hip extensors. And so we won't be able to really see that difference between the two, other than the performance outcome, basis of that. So you'd have to kind of do a little bit further investigation and then either do some manual muscle testing, comparing, hamstring strength um, between the two limbs. As far as comparison of the hip flexors, I wouldn't be, hip flexion is obviously getting the lower limb out of the way. But a lot of this is going to be the hip extensors, right? From the hamstring group, as well as predominantly the gluteus maximus group. So you won't need as much hip flexor activity, and I maybe you're referring to the hip extensors anyway. And then in the plantar flexors, so I can't do that comparison, but what I can tell you is that that's where the angulation, can help us in terms of the position of the foot, because that is a known strategy in takeoff and landing. So maybe I won't be able to tell necessarily if it's, the hip extensors or the triceps suri or the plantar flexors, but with some follow-up testing, you'll be able to tease that out. But I'll definitely be able to tell if the plantar flexors are not being capitalized. The clinical relevance, well, some of that will be up to you in terms of what you value with the metrics, and what metrics are going to be most useful to your particular population. We're finding that the relevance overall as performance-based outcome measures, there are a few papers that are basically saying that we're not doing a good job at determining return to play. And we know, for example, that simply based on the field tests of these particular methods are not good enough. In other words, just looking at the distance, for example, I showed you, there could be comparable distances, but the functional outcomes are not going to give you all of the details in terms of the predictability. And it's actually the other metrics that are going to be capable of doing that. And so, Victor, I think Oscar's going to put an email down here, but as a former professor, I'm more than happy to have further conversation and help you out with your thesis if you're still working on that. So we can get into a little bit more detail with some of that, and I can help you also with some of that literature review. The recording, yes, will be shared, and Ying, yes, it's a lot to take in. And the reason is because if I used to have a lab, so I'm used to looking at some of these, but they're not commonly reported in our field tests. So it's a greater opportunity to be able to look at this, how can we use it clinically? And I think that the professions are still sort of working on some of that. Chris, 3 questions. How much are surface changes important relative to the jump test? Yeah, I think even if you're using like a simple field test, like a Vertec, if you are on a shock absorbing floor, like some basketballs, or if you're on a cushion, that's actually going to absorb that. Very similar as if you were testing, right, someone's actual strike force on a force platform using a heel cushion shoe that is much greater than another one. So it does make a difference. So it is going to be kind of important that you use a similar surface. Is it significant? We did a lot of stuff in our lab, and it correlated to even some of the stuff we did outside on, the tar, even to a court. So I don't think it's that difference, but if you're really getting into the details for, say, statistical analysis or research purposes, it might, but it's very minuscule. It's a very small detail for most of us that will be using this for a performance-based outcome measure. Is it possible for the software to calculate an average set of data if they do 2 to 5 counter movement? So unfortunately, right now we are not capable of aggregating those averages in the test itself. What you can do is, if you do the evaluation, it will give you the change over time if you do, 3 to 5 of those tests. But I still don't think it's going to be exactly what you're looking for. So unfortunately, you'll have to actually record those in like a spreadsheet, and then run that that average calculation. And at least from then, you can also get some things like standard deviation if that really mattered. So not right now. You can't really get that average in the system. Contact stability requires high numbers in terms of speed, but a gymnast needs to stop when landing quickly. Yeah, that's what I'm saying, is if you take too much time to stop, that number is slow, right? Like driving an automobile, for me to get from point A to point B, that needs to be a really high velocity. And so in that contact stability, we want to see a much higher number. And but what I was getting at is, you may see a smaller number if they don't have as much translation to get to their stable point, right? They should react just as fast. And let me tell you, 25 degrees per second is still pretty fast, but exactly. So when a gymnast stops, they do want to stop fast, right? And that means that they need to get to their stable position very quickly, which is velocity measured in degrees per second. So you want to have a very high degree per second when it comes to going in that stable position. We don't have exact metrics on that. So what we've been finding is, typically greater than 25 degrees per second, especially with a smaller number. If it's a really large number, that's a problem, even if they're moving at 250 degrees per second, which is really fast, but they had to cover a much greater distance. And that contact stability measure is within that pronation and supination, within the frontal plane. So remember too, that if that total amount of excursion is, in inversion, if we're looking at about 30 degrees, and eversion, 20 degrees, a total excursion of 50 degrees. And if someone is moving, 20 degrees, then, that's a significant amount of motion that's taking place within the first 250 milliseconds. So we look at, the total amount of excursion taking place, which is the top number. And then the bottom number is how fast they're actually moving into that position. I hope that makes sense. Are we going to do another walking net? Yes, we will absolutely do that. I can't remember off the top of my head what the next upcoming subjects are, and I know Rana will be on me about that.
We will be showing it, Chris. No worries.
Yeah, so we will absolutely be doing. Well, we're just going to continue this cycle of going through the different types of analyses for sure. And so Oscar did put in my email address. Okay, I hope that makes sense, Ramsey. But yeah, you can also email me if we need to do any follow-up questions, or anybody can. And I guess we're slightly past the time.
I think Victor is trying to type something. Last question
okay.
for tonight.
Yeah. So while he's anyway, thank you all for sticking in with us, and hopefully we'll see you again in the next one. So remember, this is recurring, so it happens every month. We try to take a different approach to these different analyses to make it a little bit different. So even if you've seen this before, you may pick up something on the next one as well.
Okay, Chris, thank you very much to all those who participated. Really appreciating it. And I see that people saying thank you. And Victor, I will analyze the risk factor. Okay.
Oh, excellent. Yeah, that's a great topic, Victor. And like I said, feel free to reach out to me if you have any questions.
And Jan is also here. Hi, Jan. I didn't notice that you are here. Okay.
All right.
Thank you. And I hope to see you all in the next event.
Cool.
Bye.
Thank you all. Have a good night, evening, day, morning, wherever you may be. Bye-bye.
Bye-bye.